Okay, in our last segment, we will be talking about living with Crohn's. So Crohn's can be treated, and while there is no cure currently for Crohn's disease, treatment can control the condition in many cases, and with medication, most people with Crohn's disease may have just mild or even no symptoms of diarrhea and pain. Their illness may not affect their lives very much. Some patients may have intermittent relapses known as flare-ups, with periods of well-being known as remission in between, where they can live completely normal lives. Your doctor will recommend the most suitable medicines for your situation. For some patients, oral medications such as azathioprine may be suitable, while in other cases, biologics, which are stronger medicines to suppress the immune system, may be needed. And these medicines are usually given through injections. In other situations, short courses of steroids may be required. In some cases where medication alone is not sufficient, surgery may be required. For most patients, they will require long-term clinic follow-up, and for a handful, they may require urgent consultation or hospital admission when they are undergoing a flare. The goals of treating your Crohn's are based on a treat-to-target strategy. Firstly, the aim is to control symptoms or attain what we call clinical remission, and this means resolving any diarrhea, bleeding, tummy pains, and overall trying to improve your quality of life. Next, we would also aim for deeper healing from within, and this can be measured using blood tests such as CRP, which is an inflammatory marker, or stool tests, and these tests are done non-invasively to monitor your condition. But to definitively understand deeper healing, or what we call mucosal healing or healing of the intestinal lining, which predicts better outcomes, scopes may be done. Finally, it is hoped that one day we will be able to reach a point where treating the disease overall modifies your disease course for better outcomes in the long run, and this would hopefully prevent complications, hospitalization, as well as surgery. One of the reasons it is important to treat Crohn's disease well is to prevent complications from occurring. These complications could include strictures, also known as narrowings of the intestine, which will make it difficult for food to pass through or even feces to pass through. When strictures progress or cause further narrowing, obstruction or blockage may occur, and this may cause pain as well as difficulty of food passage. In other situations, abscesses or infections of the intestinal wall leading to accumulation of pus may occur. Also, other complications such as fistulas, which are tunnels or false passages between the intestines as well as other organs, may happen. In addition, in a prolonged IBD, the risk of colon cancer also increases. Although Crohn's is mainly a gut disorder, sometimes other parts outside of the intestine may be affected, and this is known as extraintestinal manifestations. The other body parts affected may include the joints, causing arthritis, the bones causing osteoporosis, or even affecting the eyes, the liver, as well as the skin. Living with IBD. Most people with inflammatory bowel disease lead a very normal and productive life. Some may need to make changes in their diet and their lifestyle. And even if you feel relatively well most of the time, it can also feel daunting at times, as you may be worried about the impact on your personal and social life, studies or work, or even plans to start a family. In terms of diet, a well-balanced diet can help to prevent nutritional deficiency. Diet alone is not the cause of IBD, but certain foods may trigger a flare or make symptoms worse. These triggers can vary from person to person, and there is no one-size-fits-all diet. Do inform your doctor if you are planning to travel or to start a family. When planning pregnancy, patients with Crohn's should discuss their plans with their IBD doctor. And in most cases of well-controlled Crohn's, women's fertility is not affected. The severity and extent of a woman's disease when she becomes pregnant appears to influence the course of her disease during the pregnancy. Women who take IBD medications during pregnancy should also discuss their concerns with a healthcare provider. It is important to understand the risk of pregnancy and the risk of stopping medications which could cause a significant flare. Sometimes a flare in itself may be more risky than the medications, and this balance must be struck after a discussion between the patient as well as the doctor. Following pregnancy, delivery and breastfeeding plans should be discussed with both their IBD as well as their gynecologist. Vaccinations are important in protecting IBD patients from infections. In general, we do advise COVID vaccination for most of the IBD patients. For some patients on stronger immunosuppressive medicines, as much as you need to protect yourself from infections, you may, however, need to avoid live vaccinations such as mumps, measles or rubella, known as MMR, or yellow fever. Before travelling or getting your vaccinations, please discuss this with your physician. We have reached the end of the video. Thank you very much for watching. I hope the information provided has helped you to understand the disease better. I would also like to thank the Crohn's and Colitis Society of Singapore for championing the patient education and providing support for patients living with IBD. Thank you once again.